Hello everyone. Today's topic is blood transfusion. What is blood transfusion? Blood transfusion is when blood or its components are given to an individual through IV route, intravenous route. Then it is known as blood transfusion. Why we perform blood transfusion? Number one, to restore blood volume. To restore blood volume. Normal blood volume is 5 liter. When 1 liter, that is about 20% blood, is acutely lost, then we have to give blood. And then second is to restore oxygen carrying capacity. In cases of severe anemia, we have to give blood to restore oxygen carrying capacity. And third is to provide blood components. In some cases, agranulocyte, in cases of granulocytosis, when granulocytes are less, then we have to give WBC. When platelets are less, as in anemia, then we have to give in purpura, we have to give platelets. Platelets are less in purpura, we have to infuse platelets. And then immune bodies. Immune diseases, in cases of immune diseases, we have to give blood transfusion. Number one, so indications are number one, to restore blood volume. Number two, to restore oxygen capacity and to provide some blood components, for example, WBC in granulocytosis, platelets in purpura, immune bodies in immune disease. What are the reactions? Blood is like a medicine. It has benefits and harmful effects also. So it must be transfused when essential. When essential, very essential, then we have to use blood transfusion. Transfusion reactions, minor, may be acute and delayed. Acute means during transfusion, reactions will appear, and delayed, that will occur after days or weeks. For example of delayed reaction, serum sickness, and acute reaction may be minor, that is fever, chills, rigor, itching, urticaria, and severe, high fever, respiratory distress, acute renal shutdown, etc. are severe cases of transfusion reaction. Then immune reaction is very serious, that is mismatched blood transfusion, that is when blood group is not matched or the direct cross matching was not done and blood is transfused. This will cause mismatched blood transfusion. This is a very serious condition and it is recognized by renal pain, pain in the renal angle, breathlessness, dyspnea, acute renal shutdown. These will appear in mismatched blood transfusion and it is a very serious condition. Then non-immune non-immune blood transfusion reaction, when RBC of donor blood is defective or damaged due to heat or during transportation, it was not preserved properly, then this will cause damage to RBC and that is transfused. This will cause reaction, non-immune blood transfusion reaction. And fourth is overload, when we transfuse rapidly, especially in case of in old age or in infants, then it will cause cardiac overload. Cardiac overload. It may damage lungs, lung reactions may occur, and there may be metabolic effects. In case of blood transfusion, there may be hyperkalemia and hypocalcemia. These are main transfusion reactions or transfusion defect or effects of blood transfusion. Thank you very much for watching. Please like, share and subscribe this channel. Thank you.